All right, ladies and gentlemen, just going to do a quick video on sodium. Sodium has gotten a bad rap over the years. It's something that has been demonized by the medical community and by some researchers. However, we are going to find out that the most recent research and unbiased research is bringing a new light to sodium and many benefits therein as well. One of the very first things that we hear from a doctor if there is a heart attack or if there's blood pressure problems, etc., is to lower your sodium intake. However, according to the most recent research, we're finding out that low sodium is actually linked to stiffening of arteries. How does it do this? When you have low sodium, that's going to increase your catecholamine release of epinephrine and norepinephrine, which is just another name for adrenaline and noradrenaline. It increases your aldosterone, which makes you retain sodium and release potassium. So releasing potassium in itself is going to throw your blood pressure off. So raising any of these adrenal hormones are going to cause you problems. And what we're going to find out is that it can actually increase your chances of all-cause mortality as well. Not only is salt an essential mineral, it can also be used to treat certain cardiac conditions, and the one I found some research on involved POTS, which is an acronym for Postural Orthostatic Tachycardia syndrome. And it was in the study, it actually decreased the arrhythmias that come with this disease. It decreased the dizziness and it decreased the fatigue. So, three of the symptoms from this particular disease are alleviated just by increasing the amount of sodium that you take in. Another study done by Kong in 2016 found that lower sodium intake was linked to a higher rate of all-cause mortality in post-heart attack patients. So people who had a heart attack and actually survived, there were two groups. One group who had low sodium, one group who had a normal amount of sodium. The group that actually lowered their sodium were more likely to die. How about that? And then the last one, last study done by Akinel in 2018, showed that the highest all-cause mortality and cardiovascular death was in the low sodium intake, which is less than 6 grams per day. And they also found that the patients who lived the longest had an estimated salt intake of 9 grams per day. Completely contradictory to what many of the medical community continue to preach and what they continue to prescribe when it comes to your nutrition and cardiovascular health. When you don't get enough sodium in through your diet, or you suffer from hyponatremia, which is just a term for low blood sodium, your body will actually harvest sodium from bone. But it doesn't just harvest sodium from bone only. When it pulls sodium, it'll also pull sodium, magnesium, and calcium. The problem with this is that it can decrease your bone density, and over time, if this is an ongoing thing, it can increase your chance for osteoporosis, which we know is just brittle bones, porous bones. They can break more easily, and it's just not ideal to have. Secondly, and certainly not lastly, with this extra calcium coming out of your bones, your body has to do something with it, so it has to get filtered through your kidneys. So when your kidneys has to filter this extra calcium, it's going to form more crystals or calcium oxalate, which we know is kidney stones. So having a low sodium intake or hyponatremia can actually increase your risk of kidney stones just because you're going to have to filter more calcium out from the calcium being released from your bones. Pretty much every time you go to a doctor and you have a blood pressure problem, he or she is going to tell you to lower your sodium intake. However, we've seen so far in this video that really isn't the case, and that's not something that should be prescribed without further investigation. In every avenue listed here on how to decrease your blood pressure, all of these avenues are without manipulating your sodium at all. We know that just increasing your potassium intake alone will lower your blood pressure, and that just means eating more fruits and vegetables. Fruits and vegetables are loaded with potassium, and as a whole, we don't consume enough potassium filled foods. We don't consume enough fruits and vegetables. Secondly, getting more quality sleep, getting more and better quality sleep is going to lead to a decrease in blood pressure. And that's because if you get poor quality sleep, there's going to be an elevated norepinephrine levels throughout the night, which is going to cause vasoconstriction. And this sympathetic nervous system reaction to getting poor quality sleep upon awakening is going to cause you to have a higher heart rate when you wake up. It's going to cause you to have higher blood pressure when you wake up. And that can obviously lead to cardiovascular problems. Third one is a given. Exercise is going to lower your blood pressure just by getting up and moving your body. And that alone is the cure for a lot of illnesses in itself, especially the cardiovascular related ones. Just get up and move your body. Sitting down all day long on a couch is not doing you any favors. Even if you are eating better, that's good, but exercise and eating better is ideal. Losing weight. Losing weight always, 9 times out of 10, is going to lower your blood pressure unless you have some kind of cardiovascular disease that's existing or you have genetically high blood pressure. But usually, 9 times out of 10, just losing some weight is going to help your blood pressure come down. And then finally, consuming foods with natural nitrates, especially like beets. Beets are so powerful and so full of natural nitrates that you cannot consume a blood pressure medication with beets, or it will drop your blood pressure down into the hole too far. And this is something that doctors don't tell you. You could actually eat beets or have a glass of red wine or even grape juice or something that will dilate your blood vessels and increase your nitric oxide levels from the endothelial cells in your vascular system to dilate your blood vessels and naturally lower your blood pressure just by what you eat. And doing that once a day can correct blood pressure if necessary, and it's a lot better than getting that out of a prescription bottle. So finally, we're getting to how does sodium increase your performance. When you start talking about things you can do to increase your performance in the gym, I highly doubt very many people who watch this video has ever considered taking in sodium prior to an athletic event or prior to a workout. But sodium has a lot of performance enhancing qualities, and these are just a few of them. Increases your blood volume, number one. You're going to retain more fluid. Increases your sweat production, which allows us to cool our bodies more efficiently. It decreases cramping. When your muscle contracts, including your heart, there is a natural gradient, a flow that happens. Sodium is supposed to exist in the majority outside the cell, and potassium is supposed to exist in the majority inside the cell. So when the cell wall opens up, the potassium wants to flow to the lesser degree, which is outside the cell, and the sodium wants to flow to the lesser degree, which is inside the cell. So when you lose a lot of sodium, and don't get me wrong, there are a lot more processes involved in muscle contraction, but just for this discussion's sake, If you don't have enough sodium in your diet, you will get cramping. It will cause your muscle to cramp or seize up, and a lack of potassium will do that as well. And that's going back to the slide before this, or one of the slides before this, where we were talking about how increasing potassium can actually lower your blood pressure alone without manipulating sodium at all. So decrease cramping. Anybody who's ever trained hard knows that a hamstring cramp is the worst thing that can ever happen. It it happened to me a lot before I started taking sodium before and after leg training, but once I did start taking in sodium before and after leg training, I had no problem with cramping whatsoever. Sodium will actually increase your endurance, and like I was just talking about, it is necessary for proper muscle contraction, given that it is an electrolyte and it conducts electricity. Electricity makes your muscle contract. And it also helps to dispose of hydrogen ions, which are just byproducts of your metabolism. A couple of the other things, performance related and sodium, is it increases your extracellular fluid, which is in turn going to increase the amount of synovial fluid in your joints. One of the ingredients, so to speak, or constituents of synovial fluid is sodium. So therefore, if you get adequate sodium through your diet, your joints are going to feel more lubricated. Anybody who has ever done a powerlifting meet and sodium loaded beforehand knows that your joints feel like titanium after that happens, especially if you take in enough fluid and sodium at the same time. And then finally, sodium increases the contractile force of your muscles, and that goes back to it is an electrolyte. It is going to conduct electricity. It requires electricity to make your muscle contract. So the conclusion is basically say what you just said. So we know that sodium has gotten a bad rap, and anybody who's ever been to the doctor or talked to anybody who has been to the doctor and had cardiovascular problems knows that, yeah, they told them to lower their sodium intake. But what do we know from this video? We know that lowering your sodium intake can actually cause a greater risk of dying after you have a heart attack. Sodium is an essential mineral. It is an electrolyte in your body that conducts electricity. It's responsible for so many processes in your body. And according to research, what we've seen in previous slides, there are other contributing factors causing problems such as high blood pressure and cardiovascular events, such as maybe low potassium levels. We know that increasing your potassium levels alone is going to lower your blood pressure. It could be that you have sleep apnea. It could be a laundry list of other things, but for some reason, sodium keeps getting the bad rap from these doctors. And then, of course, we just learned all the ways that sodium can help increase your performance. So I would recommend that you give it a shot. If you have problems with cramping, or if you have problems with running out of steam halfway through your workout, you can lose a lot of sodium when you train, especially if you sweat a lot while training. So try taking in some sodium before you work out, before you go for a run if you're a runner, before you lift weights if you're a weightlifter, especially before you do a powerlifting meet, etc. Sodium will absolutely improve your performance. I can speak from experience on that. And I hope everybody learned something this video. Thank you very much for watching.